All right. Well, good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. It is 9:02 a.m. on August 8th. Thank you guys very much for being on this call. If you're like me, we are here to improve the lives of our community with affordable health care. Thank you for being a part of that mission, and thank you for being here to learn and keep that information going into our community so that way we can make their lives better. So with that, we got to know what we're talking about. We do have some trainings and sessions this week. Most of them are looking like rollout sessions. So I'm going to go ahead and share my screen and share with you all of the great stuff that's going on out there in the world for health plan markets. So first thing is this morning at 10 o'clock, you've got WellCare doing their first look. This one's in Espanol. So if you prefer the information in Spanish, that's today at 10 o'clock. Also today, Molina Medicare is doing their training at 11 a.m. Molina Medicare is a national carrier. It may or may not pertain to you, but they do have a really, really great D-SNP plan in certain pockets of Florida and in other parts of the country as well. So check that out. WellCare is doing a first look session. This one's in English at 2 o'clock. So the one at 10 o'clock this morning is in Espanol, and then the one at 2 o'clock is in English. Moving over to Tuesday the 9th, that's tomorrow. Cigna's got a rollout session in Leesburg at 10 o'clock. You can check that out. Devoted's doing their rollout session over at the Lake Crago Recreational Center. Lots of rollout sessions happening. Another one at 1 o'clock. Cigna doing one in Lake Mary tomorrow at 2 o'clock. That's at the Top Golf. And then tomorrow, Devoted's rollout session in Daytona is at the River Grill at 4 o'clock. Moving on to Wednesday, Aetna, 10 o'clock first look for Florida North. So if you're doing business in North Florida, check that out on Wednesday at 10. Devoted's doing their rollout session at the West Shore Yacht Club for Hillsborough County at 10 o'clock. So that's a physical one there in the Tampa market. And then another at the Drive Shack for Orlando, 10 o'clock on Wednesday. So it looks like they're dividing and conquering. Another Devoted rollout session in the Tampa market at 1 o'clock, same place there. Thursday at 9, you've got Devoted doing another rollout session for Daytona. That's August 11th. That's at the Pier House over on Atlantic Drive, 9 o'clock on Thursday. And then Devoted's doing their broker coffee and chat session for us at 11:30 on Thursday. Last is Freedom. Freedom starting their rollout session. The first one is going to be at 2 o'clock on Friday. It looks like at the Red Lobster there. So check that out. This is the training calendar. Most of these are rollout sessions. Why are rollouts important? Well, you get a sneak peek and first look on what's going on out in the industry and what's happening with the health plan, so you have an idea of what to do. Big news that we've learned from the rollout sessions is Care Plus is they are setting up a new health plan with a give back plan of $170, and that is called the Carefree Platinum plan. But unfortunately, for those folks that want to take advantage of the higher give back, you do have to do a migration of your members. So that means that if your members learn about this plan and they want to join this plan, then you're going to have to move that member from one Care Plus plan to another Care Plus plan. So from the Carefree to the Carefree Platinum, and that is not done automatically, which means that there's a lot of business up for grabs there. So the first thing is we are working right now on pulling your books of business, which we're going to talk about reporting here in a moment. This is why it's key and critical, because when information like this happens, we're able to pass your book back to you and say, hey, these are the members that you currently have on Carefree. So you can call them and gear them up for AEP. This is a really big move here, probably the biggest and most interesting move that we've seen happen. So pay attention to your Care Plus business, your Carefree members specifically, because there is a new plan, the Carefree Platinum, where you're going to have to manually move those members over if they want to take advantage of the higher give back plan. So that is what's going on. But We've got our training calendar. I'm going to share with you some of the things that we've been working on in the gold key here. First thing is training. We did pull that training calendar out of the training link in the gold key. So everybody should have a link here into the gold key. We have our webinar sessions going. We have carrier trainings. Spark with their new platform, they have trainings going all the time. But we've built out the learning center here, and this is some things that might be helpful, especially for uh, rookies or folks that want to really brush up on certain things. And the biggest thing about this business is there's so much information. It's not what you can remember, it's where is the information at, and everything is going to live in this gold key. Okay, so this is kind of like your brain, right? So in here I have a little section here about how to compare Medicare Advantage plans. We pulled that from the Medicare website. Some helpful information there. Election periods, the sales process. I know some of us get lost or confused, how to do a needs analysis properly. And then we've got some videos. One thing that we did discover is Humana released quite a few in-home sales videos, basically walking you through what you should be doing inside the home. Pretty interesting stuff. So all that's housed in the gold key now. We have some call examples. So if you're calling and speaking with individuals over the phone, you can listen in to a couple of calls there. Learn about phone etiquette, phone calls specifically, and then scripts, really helpful. And then we've also added some social media information as well. So lots and lots of good stuff here in the training link. And also with the forms as well, how to report your sales. So here I want to just reiterate how important it is to report your sales. If you're using HPM Shop, if you're using our quote and enroll tool, you do not need to report your sales. Let me repeat that. You do not need to report your sales. If you're doing paper applications, or if you're doing applications outside of HPM Shop, if you're going to, let's say, United Healthcare, and you're using their lien application, what's happening is you've got your apps all over the place. And so this makes it very difficult for you to gear up for AEP, because you've got to pull your big business all in one spot. So by reporting your applications and using HPM Shop, we're syncing that information together. And then that way we can help you create your marketing campaigns for AEP. Otherwise, you're scrambling around like many of you are doing right now, trying to clean up your book of business, trying to get copies of everybody's book from each of the different carriers. So just do yourself a favor, plug it in one time, and it's all saved in one place. And that way, we can go to bat for you when we're talking with the health plans and the provider groups. So we'll leave it at that. Earlier this month, actually last month, when we did our advisor training, I talked about the new referral program. So I wanted to go through that with you guys today. Some of you are taking advantage of this referral program. And basically, this is if you bump into somebody that's in the Medicare business or deals with the same folks as you do, you can go ahead and get them compensated for referring business to you through HPM. Okay. So first thing here is it's blank. Hold on. Let me go back to the top. Here we go. All right. So how the referral program works. Let's say that you find a source, somebody that can generate leads for you. And this could be another agent, somebody like in property and casualty, somebody that doesn't want to write the Medicare business, maybe a life insurance agent, and they just don't want to deal with it. If they find a potential client and they refer them to you, once you get them enrolled, they get paid 45 days from the effective date, and we at Healthline Markets send them a check. Best practices is we like to give you the check, but sometimes it's just faster to get them the check as quick as possible so we can mail it right to them. Now, what do they get paid? CMS guidelines allow us to pay up to $100 per referral. So it is split up between $50 and $100 depending on the plan. And so this is a list of the plans that are currently in the mix here for the 2022-2023 rates. And if you can't read it, we'll send out a copy, a video of this, so that way that this is covered. Just keep in mind, this is for Medicare Advantage only. This is not for ACA or supplements or anything else, dental, vision. This is just for Medicare Advantage plans. So the rates are listed on the bottom here to the right. And again, I'll send out a copy to everybody so you have this as well. And so, a little cheat sheet there. So the system is easy. They send a lead to you, you meet with the lead, you enroll the lead, and then you have to report it. If you don't report it, then we don't know that that person is owed money, and we have to create a check request. So there is going to be a training on this, on how to get all that done. So I'll keep you posted. But if you do have somebody that's interested in referring business to you, please go ahead and start talking to them about this. This would be a great lead source for you to get going for AEP. And we made a very, very short lead form, so they can actually fill it out on your behalf. Now, we do have to get them loaded into the system. So if you have somebody says, yes, I do want to participate in that, all we need is their name, their email, and their phone number, and we'll send them instructions, because we do need to have their W-9 and not direct deposit, but just their W-9 on file, so we can get them a check. So that's it. Pretty simple. I know after the meeting, we had about 2 or 3 or 4 agents that were very, very interested, and came up with a few people that are interested in the program. So hopefully this helps you boost some lead sources and get you into the good areas, the good numbers that you're looking for to keep this thing going. Okay. Shifting quickly over to the call recording. We've been talking a lot about this, and I just want to, I think every week we'll probably touch a little bit more and dive a little bit deeper into the call recording aspect of it. And if you've been on our calls for the last month or two, we've been talking about the call recording more and more. So again, this isn't going away. This is official. You do now, starting October 1st, all calls with your clients must be recorded. Asterisk marks, okay? Starting October 1st, all calls with your members need to be recorded. Asterisk marks. We're going to talk about that asterisk in a minute. And that is during the enrollment process and any other phone calls, inbound or outbound. So if they call you and say, hey, I need to change my doctor, you need to record it. Hey, I'm interested in exploring my health plan, you need to record it. I can't, they left me at the bus station, you need to record it. All of these calls need to be recorded. So how does, how do we do the recording process? Well, we at HPM have invested in HPM Shop, Medicare Shop, which is now going to have call recording capabilities as of October 1st. That is guaranteed. We have been meeting with Connecture to add that feature to our enrollment platform. So that is happening for October 1. And you'll be able to do the enrollment portion, the call recording, and we will store those for you up to 10 years. All other calls, all of your service calls, unfortunately, we'll have to figure that out, because everyone does use different devices. So we did a little bit of digging for you. There's an app called Free Call Recorder by Rev, R-E-V, and they make it for both iPhone and Android, where you can record calls. But also, if you want to get serious about your business, you might want to consider having a business line if you don't already have one. If you do already have one, you can port your number over to a third-party solution. One thing that we use here at Health Plan Markets is Ring Central, and you could port your number over to Ring Central, and you'll have call recording capabilities, video conferencing, all the above. In fact, we're on a Ring Central device or software system right now doing our calls. So you can see that it works, and it is being recorded for our YouTube channel as well. So there it is. Also, Zoom does have some capabilities of recording as well. And then you might want to check out Microsoft Teams. So any of those solutions may work for you, but just make sure that you're prepared for call recordings. Now, I said that asterisk there. So there's two ways, or two different situations where you do not need to record your calls. The first is if you're doing an in-home appointment. So if you're in-home, you do not need to be recording that conversation. That's very creepy. Okay. So if you're meeting with Mrs. Jones and you're sitting at the kitchen table, you do not need to record that interaction. Okay. The second piece of information where you do not need to record is if your member declines to be recorded. So we'll walk you through this one more time. Hey, Justin, I'm calling because I didn't get my ID card. Well, Mr. Jones, I'd love to help you. But before I begin, I do have to, per CMS guidelines, inform you that I must record phone calls. Well, I don't want you to record me. Okay, Mr. Jones, you got it. I am just noting here that you have declined to be recorded. All right, let's see what I can do to help you. So that's how the interaction goes. Where do you notate those call recordings or the decline of call recordings? Well, we have several systems that are at your fingertips. We use Keep here at Healthline Markets. Some of you are already on that system for your CRM, but we're also promoting Spark's platform because it has a bunch of member services, pieces, and parts that are a little bit more friendly for you. So you would open up your platform, your CRM, and just notate, Mr. Jones declined to be recorded. And just save that, and it timestamps it as an interaction, and that will protect you in case anything comes, that bad thing happens. And then you can go back and say, hey, yeah, he actually declined to be recorded. So there you go. So those are the asterisk marks on the call recording. As more information comes up, I'll be covering it on these calls, so you guys get it first. Okay. Moving on here. I want to let you know that there is a blackout date coming for contracting with Florida Blue. If you are currently contracted, you are good to go. Don't worry about this message. If you're currently contracted with Florida Blue, do not worry about this next message. But just keep in mind, you got to get your recertification done. Those of you that are currently not contracted with Florida Blue and are interested in selling Florida Blue, you have a deadline of September 1st. So that's at the end of the month. You've got to submit for a contract. You'll have 30 days to complete that contract, but September 1st is the deadline to request that contract and begin contracting with Florida Blue. They're shutting it off. I guess they have enough agents at this point that they feel good about shutting off new contracting for September 1. It'll open back up in January, but this will get them through AEP. Now, why would you want to offer Florida Blue? Well, they're Florida's largest health insurance provider. Okay, 70 years of experience. They've got one of the largest networks of provider groups in Florida. Okay. Yes, they have a wide range of products, but we're only allowed to offer the Medicare products. So no, we cannot offer ACA, individual, family, or employer coverage. That's all covered under their captive channel. But we are allowed to offer their Medicare products. So the Medicare products are good to go. They do have some pretty neat things coming out as far as digital tools are concerned, which they are revamping their contracting and their selling and how they're administering and managing the health plans. So they've got some tech updates that are happening, getting really excited about that. For you specifically, just know that Florida Blue is available on Shop. So all-in-one quote and enroll tool, Florida Blue's there. You just have to get contracted, certified, and appointed, okay? Yes, they pay the same commissions as all the other carriers. They've got some really great incentives right now. Don't forget that those contests are rolling for Florida Blue. You've got $150 gas card for writing a Florida Blue app. Pretty exciting on that. And then, yes, they are focused on value-based healthcare, which includes the contracting with the larger MSOs to manage your members' chronic conditions and so on and so forth. So, Florida Blue's been really impressive with their plan designs. Those of you that got the first look, it's there. I'm going to show you how to get to the first looks because I'm getting lots of questions about that. Just remember, all of this is in your gold key. Okay. Update here for individuals that are contracted with Health First or have members on Health First or Advent Health Advantage plans. The big news that I announced, I think last week or the week before, is that they are merging the name. And so Advent Health Medicare plans are going away as far as the name is concerned, and they are merging it into Health First. So everything on the health insurance side will be Health First. So Advent Health is getting out of the Medicare game as far as the health insurance is concerned. They are not changing their name on the hospitals, doctors, or health services, just backing out of the branding in the Medicare Advantage space. So all that will become Health First. In other news, upon their initiative to expand, unfortunately, they had a boo-boo, and they are now, because of CMS, required to file a service area reduction, also called a SAR. Okay, a service area reduction means that the health plan is leaving a county or area. And Health First, Advent Health, is leaving Seminole County for 2023. So, two parts to this. Number one, do you have Health First or Advent Health Advantage Plan members that are living in Seminole County? If you do, then you need to put them at the front of the list, along with those carefree people, to contact for AEP. And you need to go see them because they are required to change their plan. If they do not change their plan, they will be disenrolled on January 1st, and they will have a 60-day SEP to choose a new plan of their liking. However, we don't want that to happen because they'll go find another agent to enroll them in, right? So if you have Advent Health or Health First members living in Seminole County, as of January 1st, 2023, they will be required to choose a new plan. They are leaving Seminole County for 2023. I have been told that they'll refile for 2024 during their expansion. With that information, it's important to know that there are probably other members out there that are going to be looking for an agent to help them find a new health plan in Seminole County. So, best practice, if you want a marketing campaign or if you want a marketing initiative, here's one for you. Why don't you go to Advent Health, Health First? I'm right here on their website. You can go to Provider Directory. Why don't you go visit those doctors that are currently in network with Advent Health, Health First in Seminole County, and tell them what's going on. Okay, and let them know that you're a licensed insurance agent and you can help their members find a new health plan, so that way they don't lose their client, their patient. Okay, so this is key information here, guys. What you do with it can make or break your AEP. Okay, so you have a service area reduction. This is where I see agents really excel and get to the next level with their book of business. So it's up to you on how you use that, but there it is. All right, moving on. United Healthcare. Many of you are already certed for 2023. Congratulations. Getting through United Healthcare is always a challenge, but now it's time to order your kits. So if you are looking to have sales kits for January or for October 1 to start enrolling, the cutoff or the deadline to receive those kits by October 1 is next week on August 13. So if you haven't already ordered your 2023 kits, make sure you do so before August 13 next week. However, you do have to complete your 2023 certification or recertification in order to order those kits. So you have to have your certification done for 23 before you go out there and order your kits. It won't let you order the kits, okay? So deadline August 13 to order your kits if you're looking to have it. On that, remember that our office is down and we will have very limited kits available. We are going to recommend that you connect with the carriers to order kits. Many of them have local offices or local support. However, do not wait until the last minute. Please make sure that you go out there and get your kits ordered, or at least have a contact in order to get your kits rolling for AEP. Okay. Remember, kits are required for face-to-face enrollments. You do have to have a kit and you have to leave it behind if you're doing face-to-face enrollments. If you're using HPM Shop remotely, we send that information to the member automatically. So you don't need to send them a kit, or you don't need to have a kit, which is preferable, right? But if you are planning to do some face-to-face, you got to have kits. Okay. So there it is on that. And then last thing here this morning, want to talk about the first looks, because we've been talking quite a bit about that. We've compiled all of the first looks that we are aware of in the first look area under the Gold Key. And this has Aetna, Bright Health, Cigna, Clover Health, Devoted, Florida Blue, Global Health, Humana, and WellCare. All of those are live. And as we start to add in the first looks, they'll be listed here as well. So going out there, if you want to check those out. So, for instance, let's say you were interested in looking at the Florida Blue. You just click that PDF and it downloads right on your device, wherever you are in the world. And you could study these first looks. And the first part is yes, I know you guys are looking at a lot of different things here when you're looking at the first looks, especially copays, but it also has sales territories, the agent managers, their contact information in your area that you're selling in. So it has a lot more to consider when you're going through these first looks. The other thing to remember is network is a really big factor here. How the health plan works, customer service, how do they treat you as a broker? Many of this is information that does not live in these first looks. But again, this is just plan design information. And it does have some key things at the back as well, different benefits that they're looking to launch, whether it's for, meals or, um, chronic conditions or things like that, dental coverage. And then it also has some of their vendors that are listed there as well. So really cool, neat documents. If you need a good thing to read to fall asleep, this will do it for you. Just kidding. We want to know what's going on with the health plans. We want to know what services are being provided. And you can jump on that information just as soon as you open up your Gold Key and get loaded there. So take advantage of that. Also, the rollout sessions are listed in there as well. I know they're happening on the daily right now, as you can see from the training calendar. So lots going on. I think the first thing to focus on right now is getting your recertifications done. Once you've got your recertifications done, the next thing to focus on is cleaning up your book of business, whatever that looks like. Get it loaded. Those of you that are using Spark for their member services, going to have to clean that up and get your account loaded. Some amazing tools that I've seen already. Very, very excited to continue down that road. And then beyond that, you've got, gear up for AEP. What is your strategy? What is it that you're going to be doing? Okay, so we'll talk more next time on those strategies, but want to take a minute to take a look at some of the messages here. Kelly's asking, can we also use a CRM for reporting? Yes, Kelly, go ahead and get with John on that. There may be a mismatch with just putting it directly in Keep. We just want to make sure that we're tracking it for you on that. So those of you that are using the CRM and just plugging in new sales, just maybe just note John on that or tag John on that, and he can tell you how to do that. All right, Marissa, does this lead source reward apply for only licensed agents, or can it be a community partner like a tax professional? Yes, they do qualify. So CMS does not have guidance saying that it does need to be a licensed agent. However, I would recommend leaning into licensed agents versus non-licensed people, just because it gets a little dicey with that. But a tax professional, I think that's a good place to talk to them about this referral program for Medicare. I would say PNC, you have captive agents, depending on their arrangement with the health plan, they might want to participate in that. And then other brokers that say, I don't really need, let's say they just missed the Florida Blue deadline and they know that you've got Florida Blue, and they can refer their Florida Blue members to you. So that's a cool little neat thing too. Okay. Okay. Tim mentions that the local manager indicated UHC kits aren't available until August 13. Yes. So they will not have kits, but you can order the kits and have them available, sorry, August 13th for October 1. So you do have to have your recertification done before August 13th in order to get those kits delivered for October 1. So just go back out to United Healthcare and make sure that you get those kits ordered on August 13th. So thank you for the correction, Tim. That is correct. You can't order the kits now. You do have to have your certifications done, and then you can order your kits on August 13th. Appreciate that correction. All right. John says, it will also take time for Spark to get your book loaded and running. Please don't wait until the last minute. At this point, if you're diligent about getting your book loaded up into the Spark platform, just make sure that you get your stuff in order, but it is taking about 3 to 4 days to get everything loaded. Really important to get your book loaded. Very important at this point right now, because it's time sensitive, right? So wherever your book is, if it's at different health plans, you've got to go grab it. If you've been reporting your apps at HPM, don't worry, we're going to help you compile it there and just cross-check it, make sure we've got all your members. And even past members, even if you came into HPM last year and maybe you've been in the business for 4 or 5 years and you want to compile it and finally put it all in one place, this is the time to do it. So that takes a lot of time and energy to really go out there and get the information. As long as you're pulling them in, we'll help you with the data set and data sort. You can push that off to Spark. They can help you clean it up. And then you open up your CRM when it's ready, and you got all your members there. And all the information that you plugged in is there. And what's great about this is it's going to continue to be enriched. This is a living organism. So when your members respond to you, or they call member services, or you call out to them, it's one CRM, and it allows you to clean up your data, and it continues to get cleaned up. So it's really nice. Stan's asking, if you do enrollment through Spark, do you still need to report to HPM? No, if you're using Shop, you do not need to report. We are working with Spark on some integrations right now, because I understand that we don't want to double report. We get it, but we don't want to miss a member either. So at this point, we'd rather you double report, just so we don't miss a member. But at this point, if you're using Shop to do the enrollment process, it's captured. Don't worry about it. And we're working on an integration to pass that right into the CRM system to Spark. So hang tight on that. We're hoping to have an answer to you before open enrollment. So great questions today. I know we're getting excited. AEP is getting here, less than 100 days. So just make sure that you spend your time wisely, gear up, and go talk to your members. This is the time to do it. All right, guys, I've got 9:35. Thank you guys very much for being on the call. I hope everyone has a fantastic week. Take care and be safe.